Can I say again how overwhelmed we were that more than 69,800 people got tested in the last 24-hour period to 8 p.m. That's an outstanding result. Thank you to everybody who came forward and got tested. That's nearly 70,000 tests in one day. So obviously all of our frontline health workers, all of our pathologists who've literally been working through the night, not only to get those tests done, but also to give people results in a timely way. The system's really scaled up, and I'm incredibly proud of each and every one person who's involved in doing those tests, conducting those tests, the people coming forward, but of course also the pathologists who are working through the night to get those results back in a timely way. New South Wales recorded 7 new cases of community transmission. 6 of those are already people in isolation, which is positive. They're all linked to the Avalon cluster. And 1 case is someone who works in the Northern Beaches. So they're all related in some way to the cluster, but 6 out of the 7 are in households already in isolation. And that's a trend we'll continue to see over the next few days and possibly weeks. So as people are in isolation, their direct contacts will start to test positive, and that's where we'll see a large number of the case numbers eventuate, we hope. And we are still concerned with potential spread through the CBD, as a number of cases did present in the CBD, and we want to make sure people who've gone back to their suburbs have not passed that on then to others, which may have started new trains of transmission, but we hope that's not the case. To date, it's proving to be constrained, but we can't be too careful under these circumstances. So we do ask everybody to limit any activity in the CBD. And having said that, we know that tomorrow traditionally is a day for Boxing Day sales. We please want to discourage people. We know this is not the easiest message to give to those retailers, but we want to discourage people going to the CBD tomorrow. Please limit your activity. If you are going shopping in the CBD, make sure you wear a mask. We've already been in contact with retailers to make sure that there's social distancing in queues, that there's 4 square metre rule respected in the actual venues themselves, and all people, all staff, and all people shopping should be wearing a mask inside those indoor venues. So we ask people to limit their activity. Think twice before you go to the CBD. We'd prefer people did not go to the CBD tomorrow, because then you have people from all over Sydney coming to one location. It only takes 1 or 2 cases for it then to spread everywhere else, and we certainly don't want to see that happen. If you are going shopping in your local area, wear a mask. If you're a staff member in that local area in the suburbs, wear a mask. Please make sure you socially distance in the queues. Make sure you respect and socially distance whilst you're in the shop. Even if you're wearing a mask, the masks are a 4th line of defence. Just because you're wearing a mask does not protect you from getting the virus or from transmitting the virus. So please make sure that you still do all those other things you need to do. Good hand sanitisation, make sure you keep your social distance, make sure you think very carefully about all the activities you're undertaking, and we really do want to reduce mobility. So I can't stress enough our urging for people to reduce their mobility, not to undertake activity unless they absolutely have to, and please avoid the CBD where you can. And if you must go to the CBD and you must go shopping, make sure you're wearing a mask and that you're socially distancing. But today is a day where it is really about thanking the community, thanking everybody. I don't think anybody is having a normal Christmas today across New South Wales, and I just want to thank everybody for your patience, the way in which we've all pulled together, and the way in which I think all of us can be confident that everyone's playing their part to be as safe as possible. And before I hand over to Dr. Chant, I just want to thank her and her team. Christmas for them is very different. So they've been working around the clock and keeping all of us safe, and I really want to turn our mind and our attention to those frontline workers who today are not with their families, but working hard to keep all of us safe, and Dr. Chant is first among them. Thank you, Dr. Chant.
So New South Wales recorded 7 new locally acquired cases of COVID in the 24 hours to 8 p.m. 4 are linked to the Avalon cluster, and 2 are household contacts from previously unlinked case in the Northern Beaches Peninsula zone reported on the 20th of December, and 1 is under investigation but has exposures in terms of transport links and works in the Northern Beaches local government area. 3 new cases were acquired overseas, bringing the total number of cases in New South Wales to 4,643. And again, can I echo the Premier's comments? 69,809 tests in a 24-hour period. So thank you to the community for hearing our message about coming forth for testing, And also thank you very much for all the health staff, the private and public laboratory systems that have served us so well in delivering those results to 69,809 people. There's a couple of venues that I do want to highlight. Again, the purpose of this is to highlight where we may have additional transmission associated with venues or venues that we're particularly concerned about. So the sports bar of Paragon Hotel in Loftus Street, Sydney, near Circular Quay, has 3 cases associated with it. So anyone at this venue while visiting the hotel at 12:45 p.m. to 3:30 p.m. on Wednesday the 16th of December for more than 1 hour are considered close contacts, get tested immediately and be self-isolating for 14 days regardless of their results. And anyone who was there for less than an hour needs to get tested immediately and to self-isolate pending a negative result. And people who are in the general vicinity who may have attended the hotel, please ensure that you monitor for symptoms and isolate and get tested immediately. It's important that you're particularly vigilant there. In terms of the CBD, yesterday I again want to repeat my urging that anyone who particularly has been in the northeastern part of the city, including Australia Square, MLC Centre and Shifley Square, should be alert for symptoms and isolate immediately and get tested should even the mildest symptoms develop. And since 8 p.m. last night, and this case will be included in tomorrow's numbers, we've had another confirmed case linked to the Paddington Terry, and the case is a child. So there are now 4 cases associated with the venue, and all diners from December 17th to 19th need to remain in isolation and get tested if symptoms arise. Takeaway customers need to get tested should there even be the slightest symptoms. We have had transmission at that venue, so it is important that everyone maintains a focus. In relation to the Qantas flight yesterday from Darwin to Sydney, we did alert you to a case that we were working up with our colleagues in South Australia. I can confirm that that case now has been identified as a historical case. And we appreciate the cooperation of the public. We did immediately call then all of the close contacts on that plane close contacts, and thank you for bearing with us, but we were able to revise that concern level down once we established that that wasn't a further transmission associated with the plane. But it is important that the close contacts on that plane still remain in isolation, because they're the people that sat in proximity to the first case I identified earlier. In terms of a safe Christmas, please limit your social interactions. There's limits on the household gatherings, please respect them. This is a critical point in our response, and if we work together, we can decrease the chance of this COVID spread. Even though it's raining today, we encourage people to use covered outdoor spaces, including verandas wherever possible. And if indoors, make sure it's well ventilated, including opening windows. Most importantly, don't risk passing on COVID to your friends and family. If you're in isolation, you have to stay in isolation. Don't accept visitors in your home, don't interact with any visitors. Even if you have the mildest symptoms and you're thinking, is it really a scratchy, itchy throat, is it a sore throat? Please don't just go out and about. Please ensure that you put the care and compassion for your loved ones as a major priority, and just ring them and tell them, I apologise, I can't come, I need to go and get a COVID test. In terms of the Boxing Day sales, can I just reiterate the guidance that the Premier has given? I understand shopping day sales can often be busy places, and we acknowledge the work that the industry has done to put in place COVID-safe plans for those Boxing Day sales. But please, you have a number of alternatives. Shop online, shop locally, and defer and delay and avoid crowded environments. And please, if you're going into those shopping sales, please wear a mask. But please don't go if you've got any symptoms, and again, keep yourself updated. We will be loading in the next hour a number of other venues onto our website, and it's important that you attend to those. Also, a message in relation to aged care. Aged care is an incredibly vulnerable setting, so please do not visit aged care if you have any symptoms whatsoever of COVID. Again, it's an area we want to protect. But please reach out to your loved ones in aged care. Give them a call and support them, because we know this is a difficult time for them, and we have instituted some restrictions on visitors which may be impacting on your loved ones in aged care. There was a previously reported case reported on the 23rd of December, and that person works at the Belrose Hotel in Belrose. Belrose is in the Northern Beaches local government area. This case remains unlinked to the Avalon cluster at this time. Case investigations and further testing around this case indicates this person was likely to have an infection onset about 2 weeks ago. We know from testing around this individual that this individual to date has not transmitted infection to others. But what we're interested in is knowing how this person acquired the infection, because the person is not linked to the cluster. So we are asking residents of Belrose and Davidson and surrounding suburbs to be alert for symptoms and to get a test. And even if you've had recent symptoms that have resolved, we ask that you present for testing. And this will help us in our investigations to better understand how this transmission event to this gentleman occurred, and potentially link it to help assist us with the investigations to see how this cluster was initiated. Thank you.
Dr. Sharp, this CBD cluster, do you have any idea of how many close contacts there could have generated by now, and how much of a concern it is over the next few weeks?
I suppose what we know is that people from the Northern Beaches, when we look at where people move in and out of the Northern Beaches, we know that a number of people from the Northern Beaches come into the CBD. So when we look at where the risk is, we know that the risk is for transmission has been greatest in the northern part of the Northern Beaches local government area. The southern part has been less impacted, but we've still seen a number of cases there. But we do know that many people from the Northern Beaches travel in to parts of southeastern Sydney and parts of the Sydney CBD. So they're the people that we're highlighting at the moment, and we have had some cases in that CBD vicinity. And so as a general warning, we're just saying there's probably a higher risk of you coming in contact with someone who potentially has not recognised that they've had COVID symptoms. I should stress that COVID symptoms are incredibly mild, and it is important that there may have been undetected chains of transmission, and that's why we're particularly calling out those adjacent suburbs to the Northern Beaches to be vigilant, and also around the CBD and southeastern Sydney, because we know from our mobility data that are the general areas where people move in and out of the Northern Beaches.
Dr. Sharp, we know that the sewage for these particular catchment in the Northern Beaches tested negative on the 10th of December. Is the concern then that we have this Belrose case who was potentially 2 weeks ago and that wasn't detected?
Look, I'd need to look at Belrose and where it's catchment drainage. So I'll have to get back to you about that. But the catchment is there are about 3 different catchments in that Northern Beaches area. We have been doing a lot of work to try and segment the catchments into smaller areas. And can I also acknowledge the work of Sydney Water? So Sydney Water staff are working as we speak, and we have sampled a lot of regional sewage over the last coming days, because one of our other concerns is there may have been dissemination from the Northern Beaches to other parts of the state. Those results will be coming in over today and tomorrow, and please I want to extend my appreciation to the staff who are working now to be delivering those results, because they do help us assess the risk across the state.
Dr. Chen, do you have an estimate of roughly how many people are in isolation across the state today, and also how many of your staff are working on Christmas?
Look, I don't know the exact head count for how many staff are working, but we have contact tracers and we have operational staff present here. There are staff manning all our hospitals and testing clinics. Our private sector colleagues are also stood up. So many staff are working, as are police and other frontline services. But the message is, if you have symptoms, there is a place to go to get tested. Please don't go ahead of just go about your business and go to that event, Christmas event. Please get tested. And we are urging people to check the website. I know I've said this, but we are trying to get data up onto the website very quickly. It does change and the messages change. So if everyone could, without crashing the website, go on every morning and just check before they go about their business. And obviously the media has been very helpful in getting out those alerts. And can I extend my appreciation to the media? Some of our contacts or cases have been alerted first by the media, and alerts that have gone out. So thank you very much.
How critical is this Belrose case to potentially solve that Northern Beaches cluster?
Look, it is one line of inquiry, and I think we are pursuing many lines of inquiry concurrently. But obviously the fact that this serological testing on this case indicates the person had the infection about 2 to 3 weeks ago, and he did report an illness around the 10th of December. Let me tell you, it was a very mild illness, but it did occur around the 10th of December. You know, clearly we have to assess and triangulate lots of data points. All I can say is he hasn't transmitted at this time to those closest to him, but we are trying to understand how he could have been infected and whether that's potentially, that person has got any potentially links back. I would like to say that this is why it's really important that we don't have any blame on anyone who, we actually do want people to come forward to testing. We don't want people to think that they're helping us solve a puzzle, and people have gone about inadvertently with COVID. It's not something deliberate, and so please know that New South Wales Health will protect your privacy. Please come forward for testing. It will help us solve the puzzle.
At this time, being unsafe.
No.
Dr. Chan, are you doing anything this afternoon for Christmas, and will you have any time off over summer?
A little bit depends on how we're going over the day, so I'll hold that in reserve.
What about you, Premier? You got any Christmas
Well,
plans
I'm
this afternoon?
making sure Dr. Chant gets a couple of hours off today. Yes, I'm hoping to see my parents and my sisters today later in the day.
Premier, the Northern Territory were the first to reopen their borders to Greater Sydney yesterday. Should other states and territories follow their lead?
Can I say all along that the Chief Minister for the Northern Territory has been extremely fair and extremely good at basing his government's decisions on the science and the data, and I want to thank him for that. He's been consistent the whole way through, and I do ask other colleagues, I do ask other state leaders to consider the actions of the Northern Territory. I think the Northern Territory's response is measured and proportionate to the risk, and I ask that other premiers and chief ministers look at that as well.
Premier, have you got any time off planned?
I'm hoping to have some time off in early January, but we'll see how we go. Thank you.
Dr. Chan, sorry,
Yeah.
just quickly, just on the protocols for the false positives out of, and even like old positives in hotel quarantine, we're hearing that there's some people that are kind of getting to the 14th, 13th day of their hotel quarantine, flying in, giving a false positive, and then maybe popping an extra 14 days, even despite giving a negative blood test. Is there any actual guideline to how long these people need to stay in
Yeah.
quarantine?
Yes, New South Wales experts have pulled together a panel to allow us to deal with this information. I just want to just correct, there's false positives and then there are old infections. And so false positives are when you haven't got the disease, and that's because occasionally our tests are so sensitive that they can react with something else and we get a signal on them, because we really want our tests to be incredibly sensitive and able to pick up those. So the trade-off is occasionally we will have these false positives. That in terms of the old infection, that becomes a little bit, takes a little bit more work, because what we need to do is confirm and understand that the timing of the person's infection, and confirm that they're no longer infectious. So these will be cases that have come in from overseas where we test them on day 2, and sometime between day 0 and day 2, they may have a high CT count showing low levels of infectiousness. We have to then do serology, and not all people also are positive on serology. So we have developed a protocol, and there is also a national process of having a protocol, so we deal with this consistently across the states and territories. But there is a lot of technical aspects to concluding with absolute certainty. Sometimes we need to retest people. So cases, we can often retest them,
And in other circumstances, there still might be doubt, and we might need to even wait a week later to actually absolutely conclude. So it's not it is a complex science, and we're doing the best we can to be very clear about whether anyone is infectious and get the right timing of the infection in the individuals.
Dr. Chan, sorry if I missed it earlier. How many cases are associated with the Paddington cluster?
I'll just refer to my notes. I think it was in relation to the Paddington, there are now 4 cases associated with the venue. So again, all diners from December 17th to 19th need to remain in isolation and get tested if any symptoms arise, and takeaway customers need to be particularly vigilant and present even with the lowest level of symptoms. The reason for that is clearly we've seen transmission at that, so people could be in the wrong place at the wrong time, so please have a very, very low threshold, and that case will be included in tomorrow's numbers, but we are trying to update you when we have any information that highlights venues are particularly associated with greater risk, so that the community is kept informed.
Thank you. Thanks
Thank you.
everybody. Have a good day.
Merry Christmas.